I mean, growing up, I served as the interpreter for my patients, for my parents, and it was always this responsibility. For me, like I want to be that doctor that like Spanish-speaking patients can go to and not have to worry about like whether the doctor will understand. And because it's something I saw not only in my parents but also in my community.
Hello, everybody. Josh Rubenstein, Media Director for Kaiser Permanente, Southern California, and this is another KP Candid Conversation. It's our chance to talk to the people, the physicians, the staff, the nurses here at Kaiser Permanente to get a better idea of what drives them. And we talk about issues in healthcare, and of course, this month we're talking about Minority Health Month, and we're visiting someone who we spoke to at this time last year. Wilkin Munoz is a student at the Bernard J. Tyson School of Medicine. He will soon be Dr. Munoz, and he was just starting out his journey, his med school journey, and we thought we might check in with him again, see how things are going after a couple of years in. Okay, Wilkin Munoz, you are now another year closer to being Dr. Munoz, correct?
Correct, yeah.
Second year of med school?
Mm-hmm. Second year.
You're a little more laid back than you were last year, is what I'm getting the sense. So you've gotten your groove in over at the Bernard J. Tyson School of Medicine.
Yeah, I think definitely, especially since the school really emphasizes early clinical exposure. I think I've gotten a lot of experience early on, and I definitely feel more in my flow and my swing of things. I think it's been a long learning process, but it's been progressive.
So tell me how does it work? It's 3 years, right? First year, second year, third year. Is that kind of how it works? And then how many?
4.
4 years. So we got 4 years, just like everything. And give me an idea of what you're doing each year and where you're at right now.
Yeah. So, I mean, the school's curriculum is very unique in that usually a lot of med schools traditionally have used the 2+2 model, where it's like 2 years of preclinical exposure where you're just like learning the book stuff, right? Like the information, the science, all that stuff. And then the second, the third, and fourth year are dedicated to your clinical experience, clinical exposure. You're in the hospital, you're in the clinic, getting hands-on experience. The school is unique in that the first year is primarily, it's the same, just dedicated to the books. But once a week, we do get brief clinical exposure in like family medicine or internal medicine. And then our second year, it's around 80% clinical exposure. So we are already from the first year getting brief glimpses of what it's like to work in a clinic and be a physician. But in our second year, we really kind of jump in the deep end and do our main clinical rotations. And then third year is like 90%, 95% like clinical, like in the hospitals, working shifts. And fourth year, it's honestly just like you're practically a physician at that point.
So tell me, what has it been like interfacing? You're starting to interface with patients. What's that like?
Yeah, I mean, I've been interfacing with patients since last year, since it does like the early exposure. But now that I'm doing more, that I'm more exposed to the clinical environment and seeing a lot more patients than I did last year, I think definitely at first was very intimidating because you're going in and it's patients aren't cookie cutter, right? Like you're in school, when you're in school and you're learning the material, it's like the chapter on heart disease, and then it's like the chapter on the kidney. Patients aren't coming in being like, I have a disease related to like my neck or like my muscles, and then it's up to you to kind of figure that out. It's basically it's a free for all. Like anything can go on, and it's up to you to really try to narrow that down. And so I think at the beginning it's very intimidating, but as the year goes on, you pick up on patterns, and you start growing your practice and your experience. And I mean, I think it's been great.
I wonder, do you envision, last year you were just starting this out. Now you're kind of well on your way. Yeah. Can you see yourself at the end of this road, practicing full time?
Yeah. I mean, definitely, especially I think this year. I think last year it felt so far,
Right.
but this year especially, I feel like even though I'm only in my second year, it does really feel a lot closer compared to last year. I mean, even just yesterday, I was in my surgery rotation, and I had like a 12-hour day from like 6:45 a.m. all the way to like 7. And so I mean that is, if I were to go into surgery, for example, that is kind of the schedule, right? And so it's become easy enough to kind of envision myself at the other side.
And what kind of medicine do you want to practice?
Yeah, so I mean, it's been a very interesting journey, I think, especially doing my clinical rotations and getting so much exposure to other fields and other subspecialties that I didn't get exposure to previously. And interestingly enough, I found myself really liking surgery in the
Hmm.
OR, and I find I love working with my hands, and it's something that, when you're working on the OR table, you get in the zone, you kind of just are doing what you're trained to do, and it's very nice and fulfilling to get to the other side and have a successful procedure. And so the type of medicine that I want to practice, definitely, leaning towards the more surgical path. I've also really enjoyed my OB-GYN rotation and working with, women and pregnancy and gynecological complications, especially since there is a surgical component to it. So it kind of fulfills that checkbox too. But I think ultimately, similar to last year when we had this interview, I still want to be community focused and oriented, and
Hmm.
hopefully with whatever specialty I go into, like one of my goals is to have like 100% or as close to 100% Spanish speaking panel. And so whatever specialty that allows me to have that patient population and really make a difference and like advocate for that patient population and be a resource for the Latino Spanish speaking population, I think is the type of physician that I want to be, regardless of specialty.
Yeah, and that was a question I was going to ask you. Has your work so far and your studies so far only reinforced that mission that you came into school with?
Yeah, I mean, 100%. I think going in and, seeing on the patient chart, right, that they're Spanish speaking, and then going in and saying like, good morning, coming in and being like, buenos dias, ¿cómo está? Like, they really like lighten up, right?
Mhm.
And the conversation just like flows so much. And then at the end of the visit, of the encounter, whatever specialty I've been into, whether it's or emergency medicine, whether I've been in surgery clinic, family medicine, like at the end of the visit, you can tell that this population feels really grateful that they were able to interface with someone who can easily speak their language, who understands where they're coming from, and not have to jump through hoops of like interpreter, because that can be, while that resource is available, can be a bit clunky where it's three people and you're talking to one person, the other person's relaying the information, and to feel like you can go to the physician and just have a conversation with whatever's going on and your concerns. I can tell that makes a huge difference for this population, and ultimately, is my community and it's my population. It's the one that I want to serve. So seeing these patients throughout my clerkships and rotations has only served to solidify what I want to do and the type of vision for my practice that I have.
And for those that didn't see the first video that we did together, the first interview, you're doing it because of how you grew up, right? And your interface with doctors and the healthcare system.
Yeah, I mean, growing up, I served as the interpreter for my patients, for my parents, and it was always this responsibility, right? Being young, like 10, we're talking 10 years old, we're talking
Yeah.
11, and having your parents' kind of concerns put onto you to relate to the physician, and then the physician's giving you all these throwing all these terms at you, all these management, take this pill or do this. And, as a young kid, you are trying your best to kind of relay that information to your parents. I think going to the doctor and understanding what's going on is already hard enough. And then being the one that translates that and interprets that, it was another barrier. And so I definitely think, for me, like I want to be that doctor that like Spanish speaking patients can go to and not have to worry about like whether the doctor will understand And because it's something I saw not only in my parents, but also in my community. Always having to maybe call in advance and say, does anyone speak Spanish there? Or like when they're a referral, when they have to go to whatever specialty, trying to find a Spanish speaking office serves as another barrier because it limits even the scope of who you can even go to. And so,
Are you prepared for that moment where you are the physician and some 10-year-old young boys coming in and translating for his parents? You can have that. I mean, I can imagine that will be that full circle moment for you.
yeah, I mean, that would be, really insane. And I mean, in dependent on the language, right? Because it could be, you know, a they could be a family that speaks another language that I don't speak. And so, but I think because of my experience, it can be something that I obviously relate to, and try to make the patient feel comfortable and heard regardless. But, if they are a Spanish speaking family, it'd be, I think, pretty interesting and kind of funny for to see the kid trying to translate and me just like stopping them and being like, it's fine,
I got this.
it's, yeah.
Now, of course, our view of med school is Grey's Anatomy. So how close is that to the world you're living?
I mean, very different. And the thing is, I had never watched, and I still have never watched an episode of Grey's Anatomy. And recently I was talking to a friend, um, and they let me know that is not actually med school. I believe they're like general surgeons doing residency. So I mean, residency, it's its own beast after medical school. So I mean, definitely that's very different. But the fact that in the show there are general surgeons doing residency, that is like so surgery is so different from like other
Really?
types of medicine. So even like the show itself like really has all these layers, I think. And I've never watched an episode, but from what I gather, um,
Are there any of the TV shows or movies of doctors that you look at and you go, what do they think? It's like not even close.
no, I mean, I don't tend to, honestly, if I'm telling the
You're too
truth, I
busy.
don't
You're working.
watch like medical dramas or
Yeah.
anything.
Yeah.
That's my day to day. That's my bread and butter. And so the last thing I want to do is sit down and watch
Go watch it
doctors running around or sick people. I get enough of that
all
already.
day.
So I'll sit
So
down and watch something else.
there you go. There you go. So tell me how what your study habits are, what your work habits are for people that are and not necessarily in med school, but just right now are in some kind of a project setting or grad school or so forth.
Yeah, so I mean, my workflow honestly is I have a master schedule. I can't live, it's electronic, and I can't live without having everything that I need to do like plopped in there. Like if I need to go um, to like a meeting, right? Obviously, like I'm going to put it in for that day, for that time. And I really like at the beginning of the week seeing ahead at what I have for that week, whether it's an appointment, whether it's a meeting, whether it's an assignment due, like I already know at Sunday, right? Like these are the things that await me the next few days. And then another thing that keeps me accountable is a checklist. And I know it's like very old school to have a checklist. And I feel like some people might feel overwhelmed by having a checklist and then it gets really long and they have like this insurmountable list of tasks. But for me, it really works. And I sort through things, whether like high priority, low priority, or I can like push this a bit further. And I go about checking things off, and it helps me to continue not only not forget things, because sometimes if I don't write it down, I'll forget, but keep track of things that I've already done and things that I still need to do. And I think in terms of organization, that for me really, really goes a long way. In terms of just like work, I think I'm very old school in that I like to just sit and read and study, and it's pretty boring, but we get it done.
Is there anything that sticks out in your head in the last couple of years that you've learned that is, just you've obviously learned a ton, but is there some lesson that you've learned along the way?
In terms of lesson, I think the first thing that comes to mind is honestly that experience goes a long way.
Hmm.
I think especially early on in medical school, you're when you're a first year and you're all nervous to see a patient, or like they tell you like go take a history, right? You're nervous. You're like, oh my God, like I don't want to do bad. I don't want to ask them questions. I want to make sure that I'm thorough. And you're all like very nervous, and you don't want to like mess up, right? You don't want to do a bad job. And I think a lot of people that go into being physicians are very perfectionist, right? We have a high work ethic. That's why we're here to begin with. And it's very intimidating to go into a space being like, I'm not sure what I'm doing.
Mm-hmm.
But I think at the same time, not being afraid to take those opportunities and chances, and take those opportunities as learning experiences, because down the line with more patient encounters that you have, even if you don't feel confident at the beginning, the more experience you garner later on, you'll see your growth is exponential. A lot of the growth that I've seen in my clerkships and my rotations, and the way that I interact with patients, the way that I think about diagnoses, the way that I think about labs and evaluations, has honestly been because of previous experience. I'm like, oh, I've had a patient like this before, or I remember when I was in my sec rotation, we did this before, or whatever it may be. Like, you are honestly astonished by how much experience like actually goes in and helps you to learn and grow, I think. And it's
There's nothing like having that hands-on doing it and experiencing it, right? Is there anything that you've along the way realized, I don't want to be that doctor, I don't want to do that, that's a red flag to me?
In terms of
like, is there like the way in which some physicians are that you say, I will not do that, I'm not going to be like that?
Not necessarily. I think luckily I've lucked out in having a lot of mentors that there's always something to learn from, and there's always something that I can expand and really implement into my own practice. But I think one thing that is ubiquitous, that sometimes threatens, I guess, the physician workflow, is just the amount of charting that is required. And I think at my school, at least, they have us writing notes. And so patient notes, like post visit. And so I've definitely felt sitting down, trying to write a note and like spending 30 minutes basically on documentation. Right. And I can't even imagine my attendings who see like 10 plus patients a day having to write all this extensive documentation. And so, I mean, definitely like I want to be a physician that is able to strike the balance, because documentation obviously is important, right? It's part of the medical practice now, but being able to strike the balance of patient care and not be overwhelmed by all the patient's notes that I have to do, all the order notes that I have to do, and not let myself just be drowned by, I guess, the administrative work that goes into being a physician that no one really talks about in med school until I feel like you get to residency and it's all just like thrown at you.
Because you're part of it, right? Because you're the one that has to write some of that stuff. Are you excited? Are you excited about becoming a doctor?
Yeah, I mean, I think I really am. And I think especially in this year, being in clinical spaces has been really reassuring. And I'm excited. I know residency will also be very hard and pretty long, but I think I'm just excited to like just see where life takes me. I definitely see so many other avenues within medicine, so many opportunities that I'm just excited to explore them and see what life has to offer through the lens of medicine and clinical care.
Awesome. Well, we're excited for you. We're excited for you to finish this journey, and we're going to follow along. I think I'm going to do this again next year, sort of our way of honoring Minority Health Month. And of course, we're super excited for you. So, and I look forward to you being out there, white coat and all.
Thank you so much.